We are going to go deep into AI and everything around AI. But first of all, a quick question. How many of you use like ChatGPT or any kind of Copilot or, yesterday? How many of you? Oh, wow. Almost like 80% of people in this room. And how many of you were using such tools 2 years back? Anyone? Okay, we do have a few people who were using it. Okay, but like less than 10%, right? So over the last 2 years, we've seen the technology grow, and we've also not only grow, but it has reached or it has sort of penetrated our everyday lives, that we are using these tools, we are using these platforms, and we are trying to make ourselves more efficient, more productive. At least that's what the selling point is here. So yeah, but with this whole potential of AI, there's a lot of like responsibility also that comes into picture. We still don't know a lot of things about different dimensions of how to implement AI, what are the practical challenges that are there while we are looking at this technology. And that's what we are going to sort of unpack today with our panelists. Look at what has been the promise of AI, how the progress has been across that promise, and what are the challenges that are on the minds of our panelists today and should be on our minds as well as we move forward in this journey. So with that, I have my first question for Geeta. So Geeta, as part of your work with Niramay, where you are designing technology for non-invasive, radiation-free, early stage cancer detection, which is great. 2.5 lakh women have used your product across 20 countries. It's amazing. We all want to understand a little bit more about how this technology works. Where is the AI coming into play, and how is it without AI? So kind of like a before and after. And do you really think AI can fast track accessible and affordable healthcare? So what's your view on that?
Okay, so good afternoon, everyone. It's a great pleasure to be on this forum, and thank you so much, Shailaja, for that question. So yes, at Niramay, we've developed a new method of detecting breast cancer, where AI is the primary sort of the game changer, which has made this solution possible. Just to go into sort of a little bit more detail, and we'll expand to other type of applications that may come in. He's trying to address this largest problem in women's health, which is breast cancer. It's just a top killer, cancer killer I would call it, where 2,000 lives are going every day because of this disease globally. And it is one of the most curable of all the cancers. Still, we are losing so many women because of late detection. People wait till there is a lump and some other kind of symptom before even they get to a hospital, get to a doctor, get to a test, which is already stage 2 or 3, because if you feel a lump accidentally, it will be 2.5 centimeters. It's by definition stage 2, 3, 4, whatever. And that does reduce the survival rates 2 to 5 years. It can be as low as 10% survival if it's a stage 4 detection, whereas the stage 0, stage 1 detection can have 90-95% survival. So what do we need? We need something that can be tested, that we can take as a test every year with or without symptoms. All seemingly normal looking people, preferably women, all of them, can go in and do this test, right? But today, the scene, or before we came in, before the AI came in, the scene was that tests were available. Mammogram is one example. It was available only for women above 45 years, because below that, women have what's called as dense tissue, where X-ray based tests like mammogram won't work. Now, also affordability and accessibility of such a test is kind of like 4,000, 3,500 rupees, which is not something that everybody can afford. So there's affordability, access, and limitation on the test, etc. So what we did was, instead of looking at X-ray based testing, we said, okay, are there any other methods of imaging, which is one, non-invasive, non-radiation based, which is obviously preferred. Then we stumbled upon thermal imaging, which is just like one of these cameras, but instead of taking a real picture, it takes a thermal scan of it. So we measure the temperature variations on the chest, and when I read out the previous literature, yes, a few doctors and few researchers had tried using thermal imaging before, but it's such a complex thing to see a lot of red, yellow, green and trying to figure out, is that cancer or is it just simple tissue activity which is sort of different in those areas. So visual analysis or human eye based analysis was not feasible for a quantitative analysis and sort of repeatable kind of analysis. So that's where we came in. We built these AI models starting from scratch, and I was talking to Sanjay and Chalini so about the first, like when we started, we didn't have even a single breast thermal image available. We just read some literature somewhere and said, okay, we bought the camera. We started off from the initial images and so on. Anyway, so with that, we've now built a set of AI models, together a solution which takes thermal maps from a simple camera like this and converts the temperature map to a cancer health report automatically. And we give a report which is very similar to how doctors would give for mammogram and ultrasound. It's called Barrett scoring of 1 to 5. And this is instantaneous. And the big thing is that just like these cameras have been brought here, it's extremely portable. You can take it out and do screening. So that's how we've changed. We made it more affordable, accessible, and most importantly, it works on women of all age groups, which is because there's 35% or at least 30% of cancer deaths under 45 years, unfortunately. So all of that is done. So the before and after piece is really the AI which has made a difference to make thermal imaging really feasible for, in this case, breast cancer. But again, it can be applied for other type of cancers and abnormalities. Once we get time and sort of collaborations, we can definitely do that as well. Extended this further, I think AI can be a huge game changer, or kind of bridging the gap between the haves and the have-nots, right? Because in a village scenario, you have simple health workers who are not able to make that decision of who among these 1,000 people really need to be brought to a hospital. For example, just to talk about breast cancer again, there will be like almost 10% of women who are saying there is some breast abnormality. But not everybody, like, could be brought to the hospital for further diagnosis. It's just a infeasible thing to take a machine there and so on. So just doing this point of care device, which is AI enabled, just with a health worker, trying to figure out who are those high risk women who need to be brought to the hospital itself can change the game really so much and bridge the gap. Several other things feasible, and maybe I can talk about it later.
Thank you so much, Geeta. No, this is really powerful and a use case beyond the chatbots that we've been hearing about, to be very honest. And yeah, very powerful. Would love to know more, but want to also move on to another domain that has sort of united at least Indians over the last 5 years is digital payments. So moving on to Sanjay with that. So how do you think AI has really revolutionized digital payments, or is on the journey of doing that? What are some of the use cases that you could share with us that could really impact our everyday lives?
Sure. Thanks first of all, it's a great pleasure to be here. I think among the panelists, I'm probably the novice in AI. I know folks here actually have really deep knowledge and experience. But interestingly enough, in 1987-88, my thesis was on neural nets. So it goes way back. And what we see as the progress now is actually over these years. I mean, 1986 was when Geoffrey Hinton wrote his seminal paper. And it's been a combination of the digitalization, the amount of data that we have, the kind of compute power that we have, the networks that we have, and of course the kind of algorithms that have now been developed. So yes, it's an inflection point, and you see this kind of a uptick and acceleration of AI. And when I look at fintech, actually I want to talk about one more topic, but I'll come to that in a moment. Fintech, certainly one of the bigger areas where it is being used is areas like identification or authentication, and then also fraud detection and risk assessment. Right? In the past, some of these things were decision trees or rule-based systems, right? Rule engines. And nowadays, it's much more the thought process is. It's not like everywhere you see it prevalent yet, but the thought process is that it is a multivariable, multi-dimensional problem, and therefore we could actually pull data from various sources and identify unusual patterns, right? It's not just about saying it is a predicted pattern, it is a definite pattern, but it's an unusual pattern, and therefore a likely fraud situation that we can control. And similarly, in terms of how to bring in credit to maybe even the underpowered or empowered masses, right? How do you remove the bias from the system so that you can actually bring in the evaluation from the various data sources? The standard data sources may not really yield you, they may actually fall out of the purview of those credit assessment algorithms. So how do you really bring in or remove the bias from the system to get there? Certainly the most prevalent one will be like what you said, the customer support use cases, where you process text, you process voice, you process messages, and then you figure out a way to automate. You get the essence out of that, maybe create a structure out of that, and be able to then automate the flow for maybe customer support and customer sentiment and such. But I think for India, there's actually more interesting use case, and it remains to be seen how quickly it comes to fore. I think there is a lot of work going on in that area. And that's to do with the fact that we have 22 official languages and a whole lot of population that is illiterate. So even though they know the language, their mode of interaction with the systems will be through voice or will be through graphics, right? So imagine if such a person would be able to interact with the systems in their local language, in their own language, in a very intuitive way, right? And those are things that AI can certainly power. There are definitely things going on right now to be able to do that, and these are definitely something we look forward to. I want to change the track a little bit, if you permit me, and
sure.
go from fintech to another topic that is very close to my heart, and that is road safety. And AI is actually a very, very powerful enabler for road safety as well. Not yet cost effective, but has the promise to get there. So one of the things that we are seeing is in terms of building solutions that will identify driver behavior, right? The input is camera images, the input is accelerometer readings, and you can not only look at the trends and analysis of how the driver is behaving, but even recommend interventions, and you can recommend warnings to prevent some of the behavior. Those of you who are from Bangalore would probably have seen some traffic lights that say VAC. Okay, that's vehicle activated control. And these are intelligent systems that monitor the vehicle movement and then can predict vehicle movement. And that's how they actually help in regulating the traffic flow and trying to keep the traffic streamlined. You probably have also heard of systems that will detect overspeeding and all quite automatically, and even the number plate, and automatically issue a challan, etc. And then there are autonomous vehicles, not so much in our country, but you've heard of autonomous vehicles. And again, posing an interesting possibility over here, because this is about progress and possibilities. And in the past we didn't really do it that way, but now there seems to be a distinct possibility of vehicles communicating with each other, right? And when that happens, you can see that the active driver assistance can go up a notch. Not just a notch, several notches, because immediately the vehicles would have the ability to know that they are in the space where they shouldn't be, right? Because they are so much directly in contact with each other without you knowing that they are actually exchanging that information. And so there's tremendous possibilities over there. And all this is actually a combination of both private enterprise and government enterprise, right? It can't be just the one. There is actually a lot of drive from the government also to help in moving this forward. And the one thing you can be sure of is that the AI models will continue to be better and better and better with the amount of data, the feedback, and the kind of new algorithms that are coming up.
Yeah. Thank you so much, Sanjay, for such interesting use cases, especially in road safety. Moving on to you, Shalini. So you have authored a book called AI for You, which has multiple best practices across domains, across sectors that have utilized AI. What is the one favorite best practice from the book, a case study that you really, really love and you feel like that is something that has really delivered the promise that AI had?
Okay, so I think I'll talk two.
Yeah, sure.
The first one is about the see, when we talk of AI, the people, the thing which comes to in mind are like either a fear or a confusion, right? Either there's fear or it's there are some multiple fears of related to what it will do to you as a person, to your organization, to your environment. There are a lot of fears, and then there's a lot of confusion. People who don't have fear are confused. What do I use? Where do I use? How much I use? So the fear and the confusion is like mind-boggling for I think 90% of the people in the room here also, including me, right? All of us have it. So the main and the thesis which I've talked about in the book is that how do you change yourself? It's a big change. It is a transformation. It's a technology. And I actually talk about that, when I was in 1980s, when I was a schoolgirl, I saw a TV program where all the bankers were striking that computerization is going to take away my job, right? There was a strike. I think some of you are very young. You are not there, definitely.
I was not there.
But it was there. It was there. And the same thing is happening. It is a transformation which is going to happen for all of us. So how do we change? So I talk a lot about the skilling and the new roles which are getting created. AI ethicist, nobody thought of it. Philosophy and AI together to find out the morality and the biases in the society. I'm telling you, this is a very big problem that we have to handle, and this itself will generate new roles, new jobs, new things, and of course being the use case capital. So the learning path, the roles which will get created, and how even in an organization we have to accept AI and culturally change the organization, and what are the mechanisms to introduce AI in your organization. That is a very important part and my favorite. And the second is actually I was talking to Geeta about it, which is the explainability part of it. Because AI is going to be about trust, which we have on AI. And again goes back to the fear problem. So the explainability part has to explain why it is giving this result to me. Right? Now today we believe Google Maps because we have believed and we have seen it, right? We know the locations and everything. But think about the problem which Geeta is trying to handle, which is cancer. People know what an X-ray report says. People know what a radiology report says. But would they trust a thermal scan? And if they need, then she and that's what she was mentioning. That she had, and by the way, Nirma is part of my book. The case study is part of my book. So the explainability and the user design. So when I talk about AI mindset in the book, I actually talk about the design principles that you need to build in, because many users do not want to believe that AI is giving that answer to them. That also is a fact, right? You do not want to know that where all it has curated, why it has given me that optimized route. You want optimized route, that's it. How do I reach fast? But what goes behind that has to be sometimes hidden to make it user friendly and adoptable. So the adoption, when it comes to specifically sectors like education, where it's a child for which you might have to assist a virtual advisor who's just prompting and nudging the child for the problem but not giving the answers, right? So how can you make that thing so user friendly to a farmer who wants crop advisory but doesn't want big agri acronyms to be used or things to be used? So how do you make it so simplistic and the user design is included into that? And how do we bring in and remove the bias which the model might be giving to us? I mean, today if you see, the models are trained on Western biases. It talks about blue for girls, pink for girls, and blue for boys, right? that's a borrowed principle. The caste the caste society that we have is a biased society which we live in, right? So our biases are also different. Our when I say our, I'm saying India. So those things are new and that have to be built in, but also explained, made it easy that why we are giving this answer. What is this, and hence if you see, there's a lot of money going into the reasoning models right now, because that's the ask. It's not just throw an answer, the reasoning, but also explain it in a user-friendly manner. So these are the two things: the learning, the change, and the user-friendliness.
Got it. Understood. No, this is a very interesting point that brings me to Apurva.ai and Anand Rajan. You mentioned, Shalini, that how it's important to explain that where the answer is coming from, but to explain it in a way that it's user-friendly, it's understandable by the person who is using that product. So I saw this very interesting thing in Apurva.ai where one of the implementation deployment is with IDR, where you could, ask a question and it sort of gives you an answer and also gives you all the sources and, where that answer is coming from. So if you could, just explain a little bit about what Apurva.ai is trying to do. What do we mean by collective wisdom there? Because that's the word that's used. And again, coming back to the biases point that Shalini brought about, how are you trying to remove those biases when you are trying to bring about the collective wisdom of an ecosystem? Because the model biases would also creep in. So how are you managing these two aspects?
Sure. Let me start by, there was a kind of a quote which just came to my mind, which is the scale of impact is directly proportional to the speed of trust, right? So that's fundamental, not to AI, to any problem solving, right? And that's a challenge we face in this society where trust is very scarce, and AI continues to make it even more scarcer, right? So that's a very important frame. But let me just take a step back and go into the why of Apurva. I think that's your ask. See, today we grapple with what you would call as complex problems, right? I think all of us have heard this word called complex problems. It's something between simplicity and chaos, if you look at a spectrum. But if you were to ask this question of what is complexity, I think honestly the answer is we don't know, and that's why the problem is complex, right? The moment you have an answer to a complex problem, it either becomes a simple problem or a complicated problem. Now, what we have attempted to do as systems thinkers, as problem solvers for society, is to understand the attributes of complexity. Complexity has a lot of interconnections. So for example, if you look at education of, say, a young boy or a girl, obviously there is a lens of taking this person from information to knowledge, from knowledge to understanding, and understanding to some form of wisdom, right? And today much of our education system is more gravitated towards knowledge. Knowledge is how to do stuff. We don't spend adequate time in us answering the question of why do we do stuff, right? That's really where the value is. So the need to examine these attributes become very critical. And when you have to solve large-scale complex problems, there are two ways you could do it, right? One is a top-down way of looking at problem solving, which is usually how governments solve. Policy becomes an angle of problem solving. Today, policy through infrastructures is a manifestation of large-scale problem solving, which is very important. We took a very different approach to problem solving itself, and we said, how do you solve problems from a bottom-up way? So for example, today's conversation had 4 role models, right? How can these role models inspire the rest of us to solve problems? They are innovators. They are constrained by challenges. Now, how do you literally bring a bottom-up view to solve problems? And how do we unlock the wisdom of such people to solve problems, right? Now, if you examine this a little further, what we will recognize is there is abundance of this knowledge, this kind of understanding, but it is locked. So if you have, so the abundance here is voice, right? If you have the ability to dematerialize that voice, suddenly that scarcity or things which have been locked have suddenly been liberated, right? So the thinking is, if you can start by bringing those voices onto a platform and then democratize it. AI helps us democratize, right? So in some sense, each of them were from different states. One was from Bihar, one was from Tamil Nadu, one was from Karnataka, and so on and so forth. Now imagine the exponential effect of this knowledge being available to others in different languages, right? So that unification and then kind of distribution of that becomes absolutely phenomenal. So the thinking is, if you have the ability to do this, now from the lens of civil society, that's where I come from, the voices of communities, on one end, the unit level voice can be brought, then the voices of the communities. Now, can it help the not-for-profits understand the communities better so that they're able to solve for them better, right? So you connect the voices of the communities to help the not-for-profits. Then you go one level up, which is the funders, philanthropies, enablers. How can they solve problems? Because they're also trying to understand their communities, which are the not-for-profits, right? So if you can take this bottom-up approach and aggregate these kind of learnings, then you are suddenly starting to see scale, right? So that manifestation of scale becomes very, very important, because in this society, we don't have uniform way of solving problems, right? What works in Tamil Nadu will not work in Karnataka. What works in Karnataka may not work in Bihar. So how do you create a unified way of problem solving where many of these voices can enable problem solving in that context, but then can amplify and help us see the bigger picture, right? And so through that you start connecting the dots, where I think the other side of this is many times we are obsessed about efficiency, right? And that's a very important frame for sure. But then we really have to start examining effectiveness of what we do, right? Efficiency gives us speed and scale. Effectiveness gives us sustainability, at least a temporary sustainability, because problems cannot, in some sense, we can act on complex problems, you may not be able to solve them, right? So that's kind of the framing around Apurva.
Thank you so much. So now moving on to this whole narrative around, I really like that whole spectrum of simple to chaos and complex is somewhere in between. Would like to move on to Anand here. If you could help us understand the kind of problem that your organization is trying to solve through AI and helping build social emotional skills. That would be really helpful. And how, what is it that AI has unlocked for you? So again, the similar question, before and after AI. So what's that key thing, that delta that was made possible because of AI here?
Thank you. So what we do is, I think a little context about this. So we fundamentally develop cognitive skills in children, critical thinking, creativity, problem solving, and emotional skills in children through a WhatsApp-powered chatbot. But we fundamentally don't think technology can solve any problem. We can enable in making a problem to be solved at scale. So we call ourselves a system plus tech model, which fundamentally we take the government support and to kind of ensure that our products are embedded in the government school ecosystem, which is basically a WhatsApp chatbot. And we work with the government to see if they need web applications or do they need something for the computers, etc. Earlier, before AI, we were fundamentally using a rule-based model. For example, if the child does an art activity, through art, obviously creativity can be developed, and there is a low, middle, higher rigor in which the child gets the videos, which is aligned to the child's skill set. So I think two things that has happened, I would say, post the last 1.5 to 2 years after inculcating AI is fundamentally an assessment. So whenever, and especially I won't say complex, like a little bit more gray topic like critical thinking or creativity, the fundamental for us to improve something, we need to ensure that we are able to measure it accurately. And earlier, to measure creativity, and that's what we have seen at scale, there are 2-3 fundamental methods that people use, which is basically a multiple choice question, self-reporting, SJTs, etc. Or what we use as an observer-based scale, where an observer goes to the ground, sees the child, etc. Observer definitely is very rich in data, but it fundamentally limits at scale when you're working with like 1 million children. I think this for us has been a drastic change, specifically after getting AI largely. So we fundamentally right now using different forms of data to measure creativity. We use images of children. So the images tell different stories. Like if a child is painting an example sky as red, then the question is, why did the child paint sky as red? So these data we are collecting at scale, we are able to collect the voice, which helps us another rich level of data. This is helping us assess the children a lot more holistically rather than looking from a constraints manner. I think that's the one. I think we are still understanding how the children are learning. So I think largely one biggest thing that we're using AI is as a tool for us to learn better about the children. Very similar to what Apurva said, how do we kind of unit voice of a child at scale so that we can aggregate at a scale of around the scale that we are operating on 60 to 70,000 children, which is giving a different perspective of how children think and at different times. So that's something that we are consciously using it for. Second also that we are using is largely the subjects that we teach for developing critical thinking, creativity are coding, electronics, art, etc. Currently, if a child has a doubt in, let's say, coding, the child's next best step to ask doubt was either earlier a teacher or a peer, or earlier we had a set of restrictive NLP models for solving the doubts. What we realize is that in itself is again a restrictive form of knowledge, because a lot of our children use voice to ask doubts, or use, again, India being a very rich land, there is a set, the languages changes every probably 500-600 kilometers. So here also we are able to use AI to kind of give children more opportunity to solve their doubts. Example is, right, earlier the child used to ask if they get an activity, they ask ki, okay, मेरे को activity समझ में नहीं आया. A rule-based engine or NLP engine can never understand what does activity mean or क्या समझ में नहीं आया, etc. While an AI-based engine can literally decode from the interaction that I've seen about the children, what does that मेरे को activity नहीं आया, which normally always means the last activity that was set. It's a very, as a human we know, as a rule-based engine you may not know. I think those kind of like giving people more agency to do stuff that they want to do is one thing that we have unlocked. As a next step, we are probably looking at how do we personalize the learning, because again, the diverse culture, richness that the land have. So along with the system. So I want to accelerate again on the word that again, tech alone can't do. At this in our education may not be the only enabler. I think we need to work with the government system.
Yeah, so essentially agency and scale are the two, main keywords here, but doing it with the system and other changes that you're putting in place as part of the program. So yeah, definitely tech is a huge enabler, and we'll be shifting gears here now, moving from the promise and the progress of AI, we'll move into the challenges and the risks that we see in the future. So like you mentioned, Anand, that in your case, tech is an enabler, but in Geeta's case, tech is the solution, right? It is the solution. And so I want to ask you, how do you ensure accuracy? Because a wrong result could lead to, a lot of like chaos, a lot of mistrust. So that's a huge part of the work that you do. So how much accurate is accurate in AI? That's the question I have.
So I think the question was very, very apt, and it kind of connects to what Anand was telling about. The amount of trust, actually implies the scale of impact, right? And also the explainability part that Shalini and I were discussing before this meeting. So accuracy is definitely the most important. If we are trying to solve that problem, we better solve that problem, right? When I'm saying the current methods are not accurate enough in dense tissue, or it's not better than people finding the breast cancer with hand, etc. So it better be better than the current standard. So that, as a developer of an AI model, and that's sort of the risk and the challenge part of it, when we see a lot of data, we get very excited. I want to learn about AI, download that and build a model, all good. And especially if you're downloading from some web, it's all cleaned up data, you have the labels all beautifully laid out, but that's not a realistic data set, right? Those of you who have played with real data, you know that there's a lot of effort in trying to make it ready for training, the training data set, etc., right? So the risk is really about enabling or sort of basically enabling the right kind of training data that comes in to enable accurate result, which of course. So how do we do it in our case? Of course, it's been now 8 years of research. So we started off with taking every bit of, as I mentioned, there was not a single breast thermal image that, though we wanted to solve in that direction because I read a small paper somewhere, but it meant that every bit of data that we collected is ours. The additional piece was that if you think about any other image, let's say you are developing a model to look at a picture and say whether there's a cat in it or a dog in it, right? So how do we get the label? I can ask 3 people and there could be some gray areas. That's why you ask 3 people and each one of us say cat, dog, whatever, and then the maximum vote is the label. But unfortunately, when we started breast thermal images, there were a few doctors, only one doctor in India and a few doctors who were able to guess whether that was cancer or not in this complicated 4 lakh, that is 400,000 temperature points in red, yellow, green, it's different shades of it, and then saying, but there is no doctor who would confidently say yes, that the label is right. So even to build or create the training set, what we had to do is make the person take our test and then go through the regular standard of care test. So every person who was coming in for a mammogram or an ultrasound in a hospital, we requested them to take our test. We requested it, it's all in a formal manner, informed consent and ethics committee clearance, all of that. Without that, we can't even touch the patient. So before they went to the mammogram or ultrasound, we made them take thermal scan, and then they go in and do all the standard of care tests until biopsy if need be. And that final sort of this offline label, ground truth, literally golden truth, was used for training the data. So that incidentally was so critical. When initially it was just a necessity. I didn't have data and I didn't have labels, so we had to do it. But as a sort of now hindsight, we see that was a very, very important decision to have the right label for the right data set, right record, I would say. So that now we are 30% better than not only a human-based interpretation, but we are 30% better than even mammography, because we had the look of mammo, ultrasound and biopsy, right? So that is where I would say, but in terms of specific numbers, we have now 50 papers and we have sort of one of the best result is 100% sensitivity and 92% specificity. So we use this word sensitivity and specificity in health just as a detour, because accuracy is a very, very misnomer. Because number of people who are healthy is much, much more. The number is many, many more times more than number of people who are ill. For example, if you look at cancer statistics, it's probably risk could be, I would say, 1%. Actual cancer could be like 0.5, etc. So that means if you scan 100 people, you may get like maximum 1 or 2 cancers, right? So that way there's a lot of imbalance on data. Let's stay with it. 100 people, 2 cancers, let's say. And so you can get 98% accuracy by just saying no, 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 right? So it doesn't even make sense. So we need to look at how many among the 2 you picked up and how many you said no on the 98% of them. So the sensitivity and specificity reflect that. Sorry, that was a simple little bit tutorial for those of you who haven't looked at healthcare. But yes, we have the best, I think, best set of results. The thumb rule that people talk about is sensitivity plus specificity being 150. That means it can be 100 in one case, that is you're detecting all cancers, but you called out 50% as false positive. 100 plus 50, that's the minimum. It's also allowed because that actually makes a huge difference. Because human analysis also has errors. There are like 36% diagnostic errors and so on and so forth we talk about. So this is the sort of the rough thumb rule, but we are by far like 192 or something, which is pretty good as of now. But it has taken a lot of effort to get there. And one little bit of additional challenge, and again we're talking about people who download data and just build models. So one little bit of advice, and I'm saying like best practice or must practice, I would say, is that how do we do the testing? One, I already talked about what is the label that we are comparing with. How golden is that ground truth or golden truth we are talking about? That's very, very critical. If you just compare with lump, I detected lump or not, but still it's not going to be good enough, right? So that aspect of it, which you typically sit with the domain expert and make sure it is golden truth, enough gold, because we may not understand. Like I came in from a non-medical background. Of course, I'm Dr. Geeta, but a PhD in computer science and AI. It helped me a lot to get into hospitals, by the way. But anyway, so having said that, last 8 years, I've only read about oncology and breast cancer and treatment, screening, and so on. So we have to get into the domain and discuss with the domain experts to get that. So that's the golden truth part of it, the label. And of course, unbiased training set is important. We need to see, like for example, we had to even scan pregnant women where there will be a lot of variation because of the milk ducts and so on and so forth, which you are just developing. So to make sure that there are no sort of, exactly, sort of biases towards, like we will start calling every pregnant lady as cancer or something, right? So we want to make sure that those things don't happen. So making sure that it's a clean training data is absolutely critical. Also, as important as it is also how you do the testing and how you call out this sensitivity specificity. So we can have a lab test where you have, let's say, 1,000 patients and data, but you know the result of both, everything. So you decide which is the training set, you decide which is the test set. And again, those of you who are AI developers will tell you, we can always decide, get the best 90% sensitivity by using the right training set. I mean, it's about making sure that the distribution of data in the training and test set is, but that's not sufficient. That's a starting point. Then you'll have to give this test in a real field data, that is to a hospital. And ideal thing is to give it to the hospital. You should never, the developer or any person from the company should never go there. Give it in the hands of the end users. Test it on people who themselves don't know that they have cancer or not. This is called prospective testing. That is, they come in, take your test, you give the result, and then the lady goes to other tests. Even the doctors, nobody knows. So you give the result first. And you have to do it for a sample size which is appropriate for the prevalence of the disease. So sample size, if it's like 2 in 100, then the sample size could be sort of at least 30 cancers to be detected and things like that. So statistical significance of the result and the setting of the testing is absolutely critical. And finally, if you're doing field testing, you really have to give it in the hands of the field workers, the ASHA workers, because they can do a lot of errors in capturing and so on. So we've come a long way in going through all of this, and I'm very happy to share that recently we completed a 15,000 wala study in Punjab, giving in the hands of the health workers across 189 locations, villages, etc. And the end result was so amazing that we actually, of course, had a lot of women, but we actually detected 3 times more cancers than earlier method. It was all there. It was all there. Like they had gone through the screening with whatever method of hand-based testing with doctors, but they were just walking around because they were too small to detect, the cancer was too small to detect or whatever. And so the 3 times more cancer, and 80% of the false positives were ruled out at the ground level. So both reduction in false positive rate and false negative rate was like amazing, and it went into Nature publication actually. So that is, thank you so much. But look up our paper. Very, very few Indian technology has gone there. But it's really possible. I think if you actually focus on the end user, because if you assume that this is being taken, this test will be used by me or by my family members, then you will actually do the right thing, is how I would say.
Yeah.
User-centered design, as we see, is absolutely critical to ensure we have the right kind of methodology to do the testing itself.
And it takes time. I think that's another thing that we're seeing, like, this whole sort of almost, flood of apps and tools and whatnot. Not sure how much time and effort and research they have put in really to claim that it's working at the accuracy that it is. So I think kudos to your team, for taking in so much effort and time and putting in that hard work that is really needed to call it a successful solution.
Thank you. And also the explainability. You will have to tell the doctor, is it because of blood vessels problem, tissue? So it's been fun actually. I mean, and a lot of learning is at tech, but also very satisfying, right? When you actually find somebody. Thank you so much for giving me an opportunity to share.
So moving from accuracy now to our favorite topic of privacy. And I'm going to feed this question to Sanjay, since he's been working on fintech a lot. So what about the privacy of the data that is being used, both in fintech as well as in the road safety example that you gave, right? People using the behavior of a driver, but that information is private to me. So, how can you use my behavior data to maybe make certain decisions? So where do we draw the line here?
True. Data privacy is certainly a very, very big concern. But I would say it's a concern even for present systems. Okay, it's not necessarily AI specific issue, but the fact is that AI systems are a little more unexplainable, or a little more difficult to decipher in terms of what exactly their model is, and therefore you do have a possibility that it can amplify the issue. But there are techniques. We certainly, even in training, use anonymized data or pseudonymized data. So personal data is not directly visible, but you can certainly associate that a trend is linked to some, let's say, a reference. So that's possible to do that. There is also the other side of it, which is to say, how do you prevent it from leaking? Right? And that is to do with how you control the access to the data, how do you control the output, right? How do you restrict the output so that you don't actually have that leakage? And again, today's system also, you will see a lot of masking that happens, a lot of even encryption that happens so that the data itself is not leaked. So there are underlying existing techniques that then get coupled with whatever other techniques we use with AI. Plus the guardrails that you would use to kind of make sure that you don't put out sensitive information. So various techniques that actually exist today. But I think the bigger problem, in the context of AI systems is actually the fact that, like I said earlier, it can amplify very, very quickly. The cascading effect, particularly because of connected AI systems, can actually be very, very quick to spread. Since we were talking about fintech, one of the examples could be that I have a fraud management system, and there may be a slight flaw in that system, right? And it could be that when I actually do a transaction, for some reason, it believes that this is a fraud. Now, if it just throws back that transaction and says that, this is rejected, that's one way to stop the fraud, right? And control the damage. But in interconnected systems, that can go very, very quickly to saying that, not only is the transaction declined, but the card is blocked, the account is blocked, my reputation is affected. It can have a very, very quick cascading effect on not just one person, but many, many people in a very, very short time. And those kind of things actually are the things that need to be guarded against, right? So apart from the kind of things that we would do to, to improve the model, one of the other things we look for is the false positives, right? And or even false negatives. And so the kind of testing that has to be done is by doing these kind of perturbations to actually trying to bring in elements that will change the various elements in that request, and trying to actually create enough noise to be able to say, am I actually going and able to identify the unusual behavior. One of the things that I've also seen, and we have actually tried to use this, they call it the adversarial attack testing, right? You're testing it to basically simulate an attack, right? Because there are hackers out there now. Earlier also we have had hackers, they exist today also in different forms. But hackers now will try to understand what is the underlying model. And so adversarial attacks also become part of my testing process now, right? Because I'm trying to actually simulate a condition which the attacker would actually generate, and therefore be able to suppress the information that I need to give out in that manner. So these are various techniques. But I would also remind everybody that because of the complexity, because of the opaqueness in some sense of the AI models, we have to remember that it's something that we do not necessarily understand fully, okay? And therefore a human supervision is still an important aspect today, right? Particularly when you are evolving that model, right? Just like Geeta said, when you have to compare with various data points and then say that my accuracy is or specificity is what it is. In the other cases, you would actually see that the supervision is required not only to say there's a judgment that is required, but even to make some calls about what we could call as circuit breakers, right? What would be the right circuit breaker? Would I stop the AI model at this particular threshold, or would I actually say, let it go a little further and only at the next high watermark, only then actually I should stop it, right? When I say high watermark, it's to do with the number of errors or the number of positives and all those kind of things that it brings up. So various techniques of these kinds should be part of your process. And the human supervision would also include audits, right? Because today, I mean, of course, you could still automate some of those things, but the audits are also so essential to say that what you're finally delivering is what you really intended to deliver, right? And how different is it from your original goal? So all these are actually very, very important aspects of it. Since you asked about road safety, I just wanted to have a little different angle to that. It's a different challenge. And it's a challenge that I think probably was alluded to by the others also, because it's a societal sector now, which I'm talking about, where data, which is actually the core of any AI training itself, is not really available. I mean, Geeta did the whole lot of grounds up work to collect the data that was really relevant for her model. And in the case of road safety, you would find that every state has its own way of collecting data, right? We do have some effort, which is, which was started with the ministry in Tamil Nadu, and then later on IIT Madras anchored it. So there are some efforts in that direction. But if you see overall, the systems are diverse, systems have grown separately, right, evolved separately. So how do you actually pull data together in a manner that is more cohesive, can make sense of it? And that's not limited to road safety alone. You will see any societal sector will actually run into these kind of problems. So some of the effort that is going on to create this good data sets for India, I don't know whether road safety is part of that set right now, but I know that there's efforts going on to create data models and data sets which actually could be used by various entrepreneurs or societal sectors is actually very, very welcome. And I think it'll go a long way in building some of these capabilities in the country.
Yeah, no, definitely, because AI needs data, right? So that is one of the big things that people are talking about. Where are we going to go get the data to train these models? And with that, I would like to ask you this, Shalini, where are we going to get the data from?
I think you have asked me the most difficult question. Where do you get the data? Yeah, so I think of course there is a lot of efforts happening in curating the data, putting the data pipelines together. There's a lot of missing data into the system. So you have, if you have to, missing data, then there's good amount of work happening on creating synthetic data which is trustworthy enough and which can replace what actually the data would be, and test the risk related to introducing the synthetic data also, right? Because it might have a bigger impact. So the data pipelines are getting created, and I think the India AI mission just yesterday announced AI Kosh, which is about lots of data sets which have been collected over a period of time, and that should help a lot of startups and innovators and even the engineering institutes or the AI institutes to build on top of it, build on models on top of it. So there is an effort which is happening, which is going on. But I think overall, if you see there is a lot of work that we have done in establishing the Digital India started, right? The Digital India economy started, and we have good DPIs in place, right? We have, and specifically from AWS, I've seen that, how we worked on Covin, we worked on DigiLocker, we worked on DigiYatra. DigiYatra is an AI model, right? It's a face recognition model which is working. Of course, the data stays on your phone and it's not the data which is available. But there have been DPIs in place which have enabled and given value to the citizen. Now, we have to figure out a mechanism and to create data pipelines based on the DPIs which have got created, right? The basic engine is in place, the basic fabric is in place, but we have to have a mechanism in which newer data sets in healthcare, in education, and when I say healthcare, it's such a big term in itself, right? It's disease. When I say agri, it is a big term in itself. You know, you have to think about that pest and potato crop and tomato crop and that region. And you know, there is a lot of missing link. I mean, today if you see the weather station also, we don't have in every 500 meters, which is there in US. So you don't have the weather data available, you are relying on satellite imagery, then you know there is a big missing piece. Now there are efforts which are happening, so there is no answer, but I'm saying that awareness has to be there and we have to build towards it, because it is definitely a very important step. Today the language, with the 22 languages we were able to solve, because AI for Bharat happened as an incubation which did a good amount of data collection on voices of that language and the various dialects as well. So it took time. It took time to create that, and then the model can be trained on that, right? What do you train the model on when you don't even have those variations available, and what are you trying to discover? So it's a very important step, but the interventions has to be by the government, the interventions has to be by the educational institutes, the intervention has to be by the volunteers, the intervention has to be by corporate organizations who can fund this activity to make the models better. So the startup community has to be eager and have that entrepreneurial set, like you know what Geeta had. She was the entrepreneur also, and she's creating data also, she's creating the model also, she's looking at the problem also. So look at the span of problem areas that she's looking at. So it's a very multi thing, and of course, like as cloud platform, the capability is there. As AWS, I have seen that the scale happened of COVID, 2.2 million doses on one day being given. So at the back end, we were working to scale DynamoDB, right? Because we know that this is a scale which has not happened ever in India, and there was a good amount of our team during COVID time just sitting to ensure that the scale happens. So with cloud, you have the technology available. The technology part is actually available for scale, for horizontal integrations, for vertical integrations. But what we need is an initiative to build and utilize and kind of bring all the sectors together.
Yeah.
Because you can do it. Large data sets are needed for Swiggy to do that. They are doing that because they have information about everybody of what the orders are going, right? So that is available. But in the societal systems, there has to be more structure created.
And with data, the next challenge is storing the data, right? Infrastructure. Not everybody can afford the costs that are there with GPUs or just storage, cloud, so on and so forth. So Anand, my question to you is, you were talking about, earlier when we connected, about frugal infra. So can you elaborate a little bit more on what are some options of frugal infra to build AI on?
Yeah, before that, maybe just an extension of the question on trust. I think that's a super important kind of topic, especially in the work we do from a civil society side. Trust for whom? Right? On one side, you have the actors with a lot of power, governments, funders, right? Let's face it. On the other side, you have communities, right? And then you have people in between the civil society, right? So I think it is so important to understand. So for example, there is so much of accelerated pace to build apps and deploy it. Now, what if a member of a community does not have a smartphone? What happens to him? Right? So how do you ensure that he is inclusive? So there's an aspect of inclusion which comes into all of this. What if what you deploy can explain but does not have highest level of quality? A farmer's crop is gone, right? Through the lens of the government, it is about making sure that it stays inside, right, inside the data centers. How do you ensure that these models or the software we build is in-house. Then there is a debate of open source versus closed source. Then there is a debate of open source from a closed country, right? So you have DeepSeek coming here. It's shifted the equilibrium of the entire ecosystem. So I think it is so important for us to introspect the complexity of trust. It is a very, very heterogeneous problem. So we really have to think about this and really look at it from the lens of the last mile, right? I think that's the point I wanted to make. When we started building Apurva, I think again the problem we tried to solve was adoption. So for example, the models we built for say IDEA, how can these work on a sub $500 kind of cost, right? And can support national scale. So that is the problem we have in the sector, in civil society, is lack of resources in terms of capital and lack of skills in terms of technology. So how do you really democratize those, and how do you kind of abstract that out, right? The second is, how can all of these be, I think when I see one set of folks who come to me and say that, hey, oh, we never work with AI, it's very complex. Right? And the framing I have is you use WhatsApp every day, right? And you use Facebook every day. So I think it's again a design kind of a thing, is how do you ensure that these infrastructures create magic moments in the most fastest, effective, quickest form, right? And obviously ensuring that these are lowest total cost of ownership, right? That becomes very important. So how do we do it? All of what we build is SaaSified, in the sense it's software as a service. Today, the work we say we do with Ministry of Agriculture, which is a pan-India initiative, that also works for the smallest NGO in the country. Because I think that's again the scaling problem, that when you build infrastructures which are so large, can it work for the smallest organization? Inclusion versus exclusion, right? So I think these are all design constructs which at a very, eventually it comes to a bit of commercials, that at a unit cost level, how do you ensure that this is acceptable for this sector? Then it's easier for us to aggregate, right? So that real bottom-up kind of a thinking is really what we have been focused on.
Thank you. A very interesting point that you brought out was about inclusion and adoption, right? We build models, we build advisory systems for farmers, to look at advisory, to go on a chatbot and ask a question, ki yahan pe pest lag gaya, so what do we do with this crop? But does the farmer really in truest sense has that access to a smartphone? Maybe the family has an access to the smartphone and not the farmer as an individual. So how does the entire AI solution then change, keeping that practicality in mind? And with that, I have a question for you, Anand. How are you ensuring that in your case, with the students that you're working, like how are they accessing phones, smartphones, these models? How is the implementation on the field happening?
Yeah, inclusion is indeed a challenge, right? Specifically the education. I think first to call it out as cleanly as it is currently, I don't think even 90 or 80% of the children or their families are on smartphones. So that is definitely not happening. And I think also to understand this currently, if you look at the internet penetration rate, it might give a very good number. But the interesting part is when you look at inclusion as a space, so we develop skills through a chatbot to a video-based model. Now, how does it work? The family has a phone. Now, there's a lot of social dynamics that play into the picture. For example, 50 to 53% of the children that we work with are girls. In a household, the girls get the phone the last. Now it's a reality, however we want to call it. The second is if the mother has access to the phone, there is more rapid access to a phone, and that clearly sees in the learning data when it comes to, let's say, another member or a father has access to a phone, which might be because of the way in which they work, might be because of social dynamics. So even the stats that, okay, a family has a smartphone does not guarantee that a child, male or female in this manner, has access to a smartphone. So 2-3 things that we tried doing it. We initially tried 2 activities a week. We had to limit to 1 activities a week. We had to go to a flexible model where the person can actually use it whenever they want to. We try to customize the nudges. So we do deep research, user research, which means a one-on-one conversations with the child, understanding how the social dynamicity plays in. So what time the nudges can go, because another problem of working on WhatsApp chatbots is, let's say if I'm sending a video on Wednesday 4 p.m. At the end of the day, if the mother or the father comes back, by then they would have got 10 more messages. And as an adult, mostly in terms of male members, they wouldn't want the child to access all the chats. They would want the child to access the chat specific to that. And pinning and all doesn't work in real at scale sense. So that the time in which the nudget goes in or the time in which the activity goes in is more important than even the activity itself. So I think it's a very multi-layered problem. Another thing also that I strongly double down is educating the user on. That's why the system plays a big role. For example, for us to launch a bot, technologically it might take 10 minutes, but to actually get to a child it takes 3 to 4 months. And why does it take 3 to 4 months? First, you go to a government, and that's the whole aspect of trust. The government then has to do a meeting with the principal then has to do a meeting with the teacher. Can it be done using a QR code? Absolutely, in 5 minutes, yes. But then that trust doesn't happen. And when the teacher does a meeting with the parent, which again they have PTMs, they have structures, etc., the teacher has to communicate the timing in which the message will come. Even if technology is a 5-minute job. So I think we look at so device access is something that we can't solve, that's a bigger in itself. But even with families with device access, how do we ensure true inclusion, especially to different genders, is something that we are actually understanding and trying to work towards it. So, yeah.
Spoken like a true implementer on the field working with the government. So no, definitely these are the practical challenges. It's not just about the tech, it's about the tech plus the system in which your user is there. So that's something that we need to really truly understand. So we are almost at the end of our discussion. I think we could go on for another hour. At least I could go on for another hour, but I don't want to bore you all beyond that. And it's, lunch is we're gonna break out for lunch now. But can we take maybe Vijayashri 1 or 2 questions? Okay, so maybe we could take 2 questions from the audience. Oh, we already have a hand up there.
Hello. Yeah. So my name is Amandeep Singh, and I'm currently working in Mantra for Change Foundation, and I have keen interest in AI literacy. So my question is towards Dr. Geeta, and considering that AI models evolve, so it's a very peculiar feature of this technology. So considering that if an AI model is trained on certain data sets, on its certain assumptions, and when it's on field, it might get evolved into a totally different direction, what its users intended it to make. And being from education, in the field of education, so there's a lot of talks around introducing AI tutors. So considering you are putting a child in a certain situation where the AI models may get evolved, so eventually, like what AI technologists, they have this plea that if the models fail, if there's an untoward event, they say that it should be used under human guidance. So why do we, eventually if it has to be under human guidance, then why do we need AI technology? And there's always a scope that since it's not working, let's keep, it should be used under human guidance. So like this is a area that's quite confusing. Thank you.
Yeah, it's a great question, and it's a new angle which has to be sort of learned by everybody. And also it's something that regulatory people are taking really, really serious about. So I'll try to sort of answer it in a sort of little bit broader level than the specific use case, and maybe people who are working in education may talk through the exact use case. So broader level, what you're asking is, AI can learn over time and can become better, etc., etc. And still at some point in time it can break, and then you need human tutors. How do we do it? So let me specifically talk about healthcare, how this works, right, and how the regulatory people are viewing this. yes, AI can learn on the go and so on and so forth. It's sort of a high level notion, but think about it. If AI has to learn on the go, it has to know the ground truth for every new thing that it's looking at, right? What is the way of giving feedback to the AI model at the time of prediction? Yes, many use cases you have that feedback. Maybe a teacher is looking at the answer and saying no, what AI said is wrong. So that's sort of the human tutor part of it. But from, let's say, a medical perspective, cancer detection, it also happens in our case. You go to a hospital we do a field testing, or maybe in a hospital, and we say somebody has cancer or risk for cancer, and she goes for the next level testing, and that testing was not cancer, but maybe some other type of abnormality. Then we can feed that back into the system and say that was a false positive, learn it again. Now, the way the regulator looks at it is the concept of locked models and learning, or learning on the go during production, or learning during development. So AI during development, or AI during what is approved for a medical device or certain set of application domains is locked models, which is learning during development. So what does it mean, right? So we talked about this use case. A person goes, it is positive in the test, and she goes and it's actually a false positive. We collect all these kinds of potential false positive, false negatives, and think about it like a software development house which is going through regression testing, next version of release of the software. Same way, you have to look at AI models being released to people as almost next version of the software, next version of the AI model will use this new data that's coming, and it will train again. But then when you train the new model and you're ready to release, again you have to go through some kind of a regression testing. Because it's just because in two cases, something came as false positive, it doesn't actually mean that you can just change it, because you have to be sure that what I said, sensitivity with specificity is meeting. So we have a process to even the change management ke liye, how does, like a golden test set, how does it behave in that golden test sort of mix of all sort of different type of methodology, different type of data sets, and say, has the sensitivity or specificity or the combination improved over what we already had? If it is going down by X%, whatever is your tolerance level, you do not release it, even though those two cases had a false positive. So this kind of locked models before production, testing before production, is very important for critical applications. Wherever you have dynamic sort of feedback possible, Netflix, you show a video and then you say, I don't like it or whatever, and there's a personal aspect. It's only impacting one user and not like everybody else. Those cases, AI in production is possible. So that's my sort of the broad view of this thing, but it's kind of generic enough, and unless you want to add anything from a student perspective. Okay. Thank you.
Thank you. We can take one last question and we'll wrap up. No more questions? It was super clear. Yes.
My question is to Anand Rajan. We spoke about AI learning and a little bit about privacy and anonymized data and all of that stuff. But the AI is, actually anyone can answer. The AI is learning and it will keep learning. So at what point do we stop teaching, or at what point do we want to know that this is it, this is how much I want my AI to learn? Or is there even a possibility to know that we can maybe stop AI from learning beyond this point?
So let me talk about this through the lens of the current wave of AI, the generative AI. See, today we have frontier models, the models which are usually so far being built by the West. We don't have as a user. So if I kind of break this down, there is a core infrastructure which is being built, and then you have the consumers of this infrastructure, which are the use cases which are being built, right? There is a journey in which these core models are being built. And that goes through its own life cycle, right? Which involves very large scale ingestion of data, validation, all of what was spoken about. It goes through what you call as RLHF, the reinforced learning through human feedback. Now today you have better ways to do it through, say, a DeepSeek, where they're using RL, reinforced learning, to do it. So where they're trying to automate that process of, in some sense, really replicating how humans look at kind of learning and trying to put that back into the system. So that is one part. Now, on the other side, I think it goes, today we have, if you look at most systems which use AI, the ones which are used for conversational side of AI, which are usually the ones where chatbots kind of are built, are the ones which extend the generative kind of models. And then there is a second kind of a space of AI models or AI frameworks called retrieval augmented generation, the RAG models, right? In RAG models, which is one of the frameworks we use in Apurva, the way we know we are doing well is, again, it goes through a series of users testing. So on one end, so I think it's kind of a balance between, or rather it's a trade-off between quality and quantity sometimes, right? So again, it is not how much of data you put in, but what kind of data you put in, right? That's a very important frame. So in some sense, it goes back to the explainability is, one, are you able to get completeness for your response? So what RAG does for you is to be able to pull these sources, and once it pulls these sources and stitches a response, does that sound complete enough from a user perspective, right? So, and the way we have built these frameworks is starting with a core set of users, which could be in the hundreds, who validate the quality of these responses. Then it goes to a next set of users who start to validate, and every time they come back to see if these responses are adequate or not, right? But this is never a one-time process. It is a continuous, ongoing process where you keep figuring things out. In all of this, I think also what is important is how much of flexibility do you want the model to have in its way of response is also very important, because we have seen people trying to break into the system. There is a jailbreak side of things, and especially in the AI, there's a lot of people have a lot of fun in trying to make this AI try and hallucinate. We have seen that happen. I don't know if you can say this, but people asking teasing questions about the government. Is the government doing the right things? Is this person in the government doing the right things? And so these are very kind of dangerous kind of responses, right? So how much will you open the AI to be able to respond right, versus how much do you close? Because once you close, the quality of response is gone. You shut it down, right? So, and in all of this also, how do you design the systems to be very humble? I think that was a point made this morning. So a lot of things have to get into how you even design such systems.
Quick, last 1 minute.
No, just, it was an interesting question. I thought I would add to this. So when you think about any model, of course you start with a problem that you want to solve. But there are a few things that you need to keep in mind that will lead to evolution, right? One is that you may actually have additional inputs, right? I mean, to give you an example, I said about road safety, and I was talking about driver behavior, right? If you took only camera, you have one kind of a model that will evolve. If you add accelerometer, you would have another kind of a model that will evolve, right? So a new input would actually lead to evolution of the model. And this is also linked to the technology, right? Because the technology is evolving, technology is becoming more cost effective, you can actually leverage that. The other aspect of this is use cases. And I think that is actually even more important than just the technology itself, because it's finally about where you're trying to use it. I think Geeta may have actually more interesting examples of this, because the core technology, when you apply it to some other aspect, means a new model has to evolve, right? It's not, she might have to go through the whole process all over again to collect a new data set and do that all over again. But that's actually the thing that is more important, new use cases. And that's even more important than just using AI for automation or generation or whatever, right? Those kind of things. Fine.
Thank you so much to all our panelists for taking out the time, and to this amazingly patient audience listening and actually not leaving the room also in the middle, which is like great. This means that you were interested in what was happening here, so I'm very happy about that. So thank you so much for taking out the time, and yeah, we'll break for lunch now. Thank you.